problem, you don't need a background. Just open your brain. What exactly is going to make my project run? You're doing a study in Kaplan. And you're saying, okay, I'm examining the IMG graduate for, what do you want, Hassan? IMG graduate for what? An interest in research.
Okay.
So IMG graduate, an interest in research. I did my project in Kaplan, Chicago. How many Kaplan Chicago works outside? They're IMGs, not Saudis. They work in Kaplan and they work outside as either research fellow or anything. Compare them to Newark, New Jersey. The opportunity are different, or is it about?
Different.
Someone who's in Newark, New Jersey, how many hospitals in there? How much? It was one.
It's at University Hospital.
UMPJ.
The only
So it's one
university.
hospital. Here I like almost 7 hospitals in less than half an hour. So if I did my study in Kaplan, then no one is gonna look at it. Your study is not representative. Like if I did, we have 3 big centers in Kaplan in the US.
Yes.
New Jersey,
DC.
DC and Chicago. If I did it في الثلاثة هذولا and I made sure everything is at least balanced, let's say I know إن السعوديين أكثر في كل مكان, I'm gonna take 10 people from each nationality. I avoid إني أنا أوريهم إنه sample كلها سعوديين. Then at least my study is good. They're gonna accept it. They're gonna look at it. وممكن يرجعوا لك فيها يقولوا لك please modify this and this and this. But at the end it will make it, and your name is gonna be in the journal. Analysis and write-up, I'm not gonna lie to you. This part you cannot do it without help. This part, when you do all this, collect your data, and then you go to the program director and show him, this is my whatever. You're interested in cardiology. I'll go to Rush أشطر من UIC في الريسيرش عندهم أكثر. I'll go هناك I'll find بني آدمين, let's say Somberg. أنا أوريه إنه I did everything. I just need someone's experience عشان أسوي الanalysis, and I need أحد biostatistician عشان يسوي لي شغلي. عادة اللي زي سومبرغ والناس اللي يكونوا عندهم research publication هم عادة اللي يكونوا editors. They can let you know, no, روح لذاك and I'm gonna talk to her. I'm gonna talk to him ولا her. He's gonna do the analysis. وسومبرغ he's gonna tell you how to write. يساعدك يدخلك في الجورنالز اللي he is an editor فيها. وبعدين he's an editor. He can tell you إذا الارتكل حقتك حتروح والله this is wrong, خلينا نشيلها. سوي some group analysis. أحيانا الريزلت ما تكون كويسة. لكن لو رحت للناس دول اللي اوريدي عندهم خبره فوالله ايه الفاريبل حقتك ده يجي مع ده, خلينا نقسم ده ظبط لك هي وطلع لك اياها تجنن. ايش استفاد؟ حط اسمه. ايش سوى هو استخدم دماغه. حط اسمه وانت حطيت اسمه في نفس الوقت. يلا كمان والله شكرا على تعرف احد يدخلني ريزيدنسي. هو عنده حاجه لما يروح يسوي لك دعايه, والله هذا الادمي جاني سوى كل حاجه وبس جاني اسوي الاناليسيس. فهو بالنسبة له والله أنت كويس. هذا if he did not even offer it. يعني I would go to UIC مثلا إذا أنا عندي research وأشياء زي كده, بس they're gonna take you. لكن فين حتلاقي resources to help you? It's Rush. Northwestern شوية العالم اللي عندهم فلوس الدنيا. مين اللي لساتهم junior faculty and they're gonna help is Rush. Loyola is another option, but ما عندي معلومات عن Loyola مثلا. But I would do everything. وبعدين I would not أجو هناك وأنا ما عندي ولا معلومة. I start to read شوية وإيش الأناليسيز اللي تنفع على حقي, وأروح كده وأنا فاهم يعني, وخلي الكلام ما قل ولا يعني طلع كلمتين ما حيبان إنك أنت ما أنت فاهم مثلا. And then you submit it و good luck. I'll go دحين. So it's هنا هذه عجبتني. يقول good ideas are put on paper while the great ideas usually put in motion. Okay, so أنا أخذت الإكزامبل حقي. I'm doing neurology. I'm mainly doing stroke دحين. And my interest is depression. So how you're gonna get questions? By going and reading over and over. What to read? The easiest way, you can go to PubMed, read each articles one by one, or only read meta-analysis or review. Meta-analysis or review, هذول في ناس ما شاء الله عندهم وقت. And they sit down and يقول لك we reviewed all the depression and stroke publication من 2000 until 2015. Bravo. Read this article, you're gonna have a good idea. And then بعدها انت you can tailor your reading. Conferences. If you were able to attend, أعتقد في conference حقت ال AMA في أغسطس. في ال AMA حيسووا الكونفرنس هنا في شيكاغو. AMA. American Medical Association. مو AAN. حيتعمل في اوغست. let's say هذا conference ما هو knowledge wise بس مثلا الامريكان اكاديمي اوف نيورولوجي. when you go there عادة احنا ايوه انت trying to network بس انت اذا جلست هناك and you choose your interest, whoever gonna present is gonna tell you, oh, we have a gap here, we have a gap here. If you did the following, which is, oh, okay, that's a gap, I can do something. Here a gap, I can do something. And then you go and تسوي البubmed search حقتك, you have questions. It's easy to work in a field that there is 1 or 2 publications rather than a field where it's randomized clinical trials. You review articles and then you put your research question. Where are you gonna search? To start with is website. Yes, you need money to access those places, but I'm sure every single one has a friend who's in residency. Give them a call, tell them, can I get your password? That's the way. PubMed عادة it will talk about everything في التوبيك حقتك. مثلا I'm gonna talk about depression and stroke. I'm gonna read about stroke, I'm gonna read about depression, it tells you everything. I would not trust PubMed up to date, but it gives you an idea. It gives you an idea. وعادة what I do usually is I read up to date and then let's say في paragraph عجبني حطوا reference, I'll go to the reference and get the article. وكده انت you're actually reading and reading. قرأت up to date, you went to the reference, الريفرنس هذاك قرأت الارتيكل حقه في كم كلام في reference ثاني. This is how you build your knowledge. PubMed, unless you are in residency or you have someone who can give you the access, you won't be able to get the full article. Like you can get the abstract. The abstract is enough to tell you is your question مثلا already done or never done. You need the whole articles عشان to build the design. A way to get those information is I would go to Rush Library, or I would go to UIC. لو رحت للlibrarian, give her all the references, she give you the article. Or you can abuse Hassan, get his access, or no seriously, or go مثلا let's say Rush. I don't know is it بس أعتقد إنه up to 6 p.m. you can go. إذا رحت للدور التاسع في حاجة اسمه MAT. الدور التاسع في النهاية by using Rush computer, any single articles in PubMed, you have the full article. I'll go there, get all the articles, click. Cochrane إيش هذه عبارة عن database. هذول شغلانتهم الشاغلة يجلسوا and they pick up let's say MI outcomes ولا MI mortality ويقوموا يسووا meta analysis. هذا هم they got paid by doing meta analysis. That can be مثلا point 1 إنه I know what research is available and what I should do. You don't have ignore the fact that فيها معلومات كثيرة tables غريبة because it's meta-analysis. They have their own. It's not our own biostat. Whatever إحنا درسنا في Kaplan is different. I would just go عشان أعرف where I should do my research because هنا you don't have that much support. I'll go with sample things. I'm not gonna مثلا do حاجة أليمة ولا simple association, simple cross-sectional اللي ما حتعقدك بحياتك. Second, textbook. There's always every single textbook in this world. And then conference. Again, if عندك أحد في residency, you can access most of the electronic textbook ببلاش. Conference زي ما قلت. Okay, I made up those questions honestly when I was doing presentations. How I was able to make up those questions because I read a lot about stroke and depression. So my possible first question is SSRI, selective serotonin reuptake inhibitors, versus cognitive behavior therapy in stroke patients with depression. So أنا بدي أشوف which one is more effective. That's one question. The other question is what is the best time to screen for post-stroke depression? We know إنه العالم I know إنه post-stroke الناس اللي عندهم stroke usually have a higher incidence of depression. They have I think 29% per year. الcumulative حقهم 59. So we want to know when is the best time to screen a patient اللي عندهم depression and be able to know they have depression. Is it the day 1 where I admit them? Day 5 ولا before I discharge them ولا maybe the first day after in the outpatient clinic? The other possible question is how are we going to predict depression in stroke patients? Usually anything that tell you predictors, that means I'm only going to use either history or examination or مثلا family history, previous admissions عشان I predict مثلا آدمي عنده family history of depression, آدمي عنده multiple comorbidity, the severity of stroke is worse in someone I assume it may put the patients in a high risk of depression. But how are you going to prove it? You need to run something. Then what is the effect of depression in stroke outcomes? Anyone can take those questions, go search, see إذا عندنا إحنا previous publication, but I'm sure none of those questions was answered. لأنه literature في depression post stroke is not that good. So the other problem, you get a good question, you don't have a source of data, no research. You need to know your data. So everything we know is survey. Everyone knows that we can do surveys question. My project اللي حسويه في السعودية, it's one paper. Survey هيروح لواحد في المستشفى, they're gonna fill it, bring it back to me. خلصت الحكاية. وإيش اسمه ذاك؟
monkey survey.
Yeah, monkey survey. الدكتور حقي ما يبغاني أرسل ورق, يبغاني أرسل link for monkey survey and that's it. This is one. The other thing اللي I learned at Hopkins, every single clinical trials في ذي البلد, بعد ما clinical trial is done, they release their data set. Make up a question, and then email them, this is my hypothesis, would you please to give me access? And they're gonna give you all the data. And those data usually 8,000, 300,000. But you just get the data, you have to have a question. They're not gonna give you the data without question. Get the question, send them, they're gonna give you all the data هم تعبانين عليها وسووها prospective وجلسوا يجروا ورا الناس 15 سنة, you get it in one day. Do your analysis, you can publish.
They need a proposal, full proposal.
They need to know your hypothesis. They have لأنه when you tell them your hypothesis, they may tell you, oh, الداتا اللي عندنا will not cover your hypothesis because they know the data هم. وممكن يقولوا لك, oh, no, هذه الأشياء we are publishing, so you cannot publish حاجة إحنا we're publishing it. بس if your hypothesis was okay مع الداتا حقهم وما هي شيء هم يبغوا, they want to publish, but they give you the data. As simple as this, they give you كل الداتا decoded طبعا ما فيها اسماء مرضى والمعلومات اللي ما فيها أي شيء من المفروض إنه against HIPAA, and you get the data. ريح دماغك, لا جمعت ولا حاجة, and you have perfect data. طبعا يجي انت اخذت داتا حقتك نظيفه, لان انت ما عندك مشاكل في الداتا, يجي الشغل على الاناليسيس. Are you going to do your analysis with design صح ولا لا؟ Survey قلتها, collect your own data مثلا in Kaplan. Clinical trial. في حاجه ثانيه اسمها registry. كل ما تشوف حاجه اسمها registry, that means هذول الناس شغلانتهم, let's say ataxia registry. اعتقد ان انا حاطه صوت. Yes. حطيت لكم, those are possible things that you can get information منها. Let's say مثلا National Parkinson Foundation. هذول الناس, they collect almost 500 Parkinson patients every year. وظيفتهم إنه whoever عندهم كذا centers في كل أمريكا, whoever patient يجي عنده Parkinson في شيء يتعبى والfollow up حقته تتعبى, and they fill everything ودكتور اللي يعبيها. So just get the questions, get the data, run the study. Can you do it in Kaplan? Yes. It's not impossible. I would get the question myself. Sometimes you need help. If you عندك مثلا سؤال, سؤالين, ثلاثة, أربعة, we all know ناس في السعودية. The easier way is أنت ما تبغى تروح تكلم الأجانب اللي هنا. Someone in Saudi, what do you think? This one or this one or this one? Or I would email الآدم اللي في National Parkinson Foundation, and what do you think? I have this project in mind. عادة هذول الناس ما عندهم مشكلة يدوا لك معلومات. They will tell you, oh والله بس هذا ما ينفع, هذا ينفع, هذا ماني عارفة. I'll take their advices until I أطلع سؤال and make sure إنه السؤال حقتك مهم. Then I'll get someone to help me with the analysis. Ataxia patient registry هذه برضو موجودة. Friedreich's ataxia موجودة. Dystonia coalition هذه أنا كنت أشتغل عليها. Dystonia is a new أصلاً هم this was a nature history registry. Nature history registry, they don't have much information about the disease itself. They don't know البيشنت إيش حيصير لهم. So they're running هذه registry أعتقد 5 سنوات و 3 سنوات عشان they want to see, okay, أنت عندك dystonia, after 3 years what are you going to do, after 5 years what are you going to do. And they're collecting everything. أعتقد they meet in October صح. They meet usually in October in Atlanta. أنا رحت twice الميتنج حقهم, and they're more than happy إنك ترسل لهم أي حاجة. What do you want to do? Spasmodic dysphonia? There is nothing about spasmodic dysphonia. إذا أنت قلت لهم أنا I want to do something about spasmodic dysphonia. Spasmodic dysphonia, الfocal cord فيها dystonia. So when they talk, الكلام ما يطلع عادي لانه هم عندهم dystonia في الفوكال كورد. It's a new disease, no one knows about it. You want to do a meta-analysis or a review is easier than meta-analysis. You can do it. مين الفوكال point other than the attendings is the librarian. You went to the librarian في UIC, في RAS. Those people, they're not medical. عندهم وقت فاضي. And they love to answer questions. بيقولوا لا I have a meta. وبعدين هم لما يجوا يقابلونا يقولوا do not come at the end of your project. If you have a project, تعال عندنا من البداية we give you everything. هذول الناس this is their job but no one asking them. So انت لما تيجي عند بني ادم هذا وظيفته يبغى يجاوب على اسئله وما حد يجي حيديك كل حاجه. ف librarian is a good option. Okay, so your study project setup. What are you gonna do? Null, alternative hypothesis. أخذتوها في Kaplan. Then your study population. Let me see. Your study population has to do with your question. If I'm gonna study stroke and depression or post-stroke depression, then I need to survey patients. مثلا in the last, I know depression usually in most of the literature for 5 سنوات. كل الأرقام هذه within 5 years, after 5 years from the stroke. So I'm gonna survey مثلا, let's say where I'm gonna do it. I'm gonna do it in UIC. إذا I'm gonna do it in UIC, my population is not representative of Chicago. UIC عادة يكون عندهم الأفريكان أمريكان صح؟ أغلبهم أفريكان أمريكان, low socioeconomic.
Minority.
Spanish. وإيش ثاني عندهم؟
Even Middle Easterns. You can
مو
find them.
كثير.
No, but you have.
If I did it in Northwestern, I'm gonna go to the rich, high socioeconomic people. If I did it in Rush is a little bit of white people. More.
Combined.
No, it's not combined. It's white people. No.
They have some.
Sorry?
They have some low social, or you don't have.
But not as much as UIC is based on the minorities. يعني احنا اصلا when we talk to patients عندنا portable translator لأنه most of them do not speak English. So if you bring a portable translator شغله I need this language وانت تبدا تتكلم مع نفسك مع الكمبيوتر ده الكمبيوتر يتكلم مع patient. ف I am in UIC. I cannot tell UIC unless I need fund عشان اسوي مثلا project في UIC or Northwestern or Loyola or University of Chicago. I don't have fund. I'll do it. But I have to compensate. مثلا when I write the articles, I have to say, I know مثلا أنا عندي مشكلة في population because UIC population is كذا كذا كذا. If you write this in your article, it saves you. خلاص هو حيرجع يقول لك والله أنت your population, but at least you mentioned إنه you were aware إنه population حقك is not representative of all Chicago area. Study design. I'll go with the basic things we studied.